show you how to pull an arterial line using a C-clamp. First, I'm going to wash my hands. I'll be right back. So now that I've washed my hands, I need to introduce myself to the patient. Hi, Mrs. Smith. My name is Helen, and I'm going to pull that arterial line now. It's going to be a lot of pressure, so I need for you to relax, not fight against me. And I'll explain the whole procedure as we go along. So the first thing I want to do is put the side rail down, and I need to put your head flat because it makes it easier to get it to stop bleeding with you flat. And I am going to just move your arm out of the way for now. I'm going to put on a gown to protect my clothing from any blood spills. And during the real line pull, I would put on a mask to protect my eyes and mouth from any blood spills. But for the video purposes, I'm going to skip that so you can hear me. Here are the supplies that I have brought into the room. A pack of betadine swabs to clean the groin site, some sterile gloves, 2 pairs of unsterile gloves, 2 gauze sponges, bolts, a foot for the C-clamp, here's the C-clamp. This is where the actual pressure will be. A clear plastic dressing if desired to cover the site, and a Band-Aid and betadine ointment, and of course my gown. So now I'm going to expose her groin and also the foot. I need the entire leg uncovered so that I can monitor the color of the leg during the line pull. And so here's the groin. I'm going to cover the peri area to maintain her privacy. So the first thing I see is that she does have a dressing over the sheath. So I'm going to remove that dressing, and sometimes it is quite sticky. So you have to hold the sheath as you remove it because I don't want to pull out the sheath accidentally when I'm not ready. So now that's off. I'm going to check for the arterial pulse now. So the arterial pulse should be right following the line of the arterial sheath. And I feel it here. And I'm also going to go down and feel the pulse in the foot. Put a good amount of pressure on the groin to make sure that I am in the right spot. If I am in the right spot, I should feel a decrease or absence of pulse in the foot. If need be, you can use a Doppler to find the pulse in the foot, and sometimes you actually need a Doppler to find it in the groin. The next thing I want to do is to draw back 5 to 10 cc's of blood from the arterial sheath. And the reason is I don't want to strip a clot as I put pressure on that sheath. So I'm going to turn the stopcock and remove 5 to 10 cc's of blood. Of course, this is not a real sheath, so you won't get blood. I turn it off. The next thing I want to do is open up my betadine swabs and try to do that carefully because these tend to squirt. We want to clean the site from the inside out with 3 betadine swabs. So we're going to start from the inside and roll it out. And then we do this 3 times to cleanse the site. And I'm just going to skip the last one for video purposes. And I would dispose of this in the trash. Okay, so the next thing I want to do is to get my C-clamp under the patient. And I do this by pulling out the draw sheet from under the patient, and I'm going to ask the patient not to help me. I'm going to lift up the patient with the draw sheet as I place the clamp under their buttock. And I want it to be at a line, at an angle, to follow the line of the artery. So I have it down here and it's close to the patient, so this will brace it. I also want to make sure I'm pretty much at the top so that if you have any obese patients, you're not going to hit their abdomen as you place this underneath them. And the next thing I want to do is make sure that this is in the middle, because if you have to go up or down during the line pull, you don't want to hit the bottom too quickly. I'm also letting this betadine dry as I get all my equipment ready. So the next thing I want to do is to apply my pressure pad to the C-clamp. So you open it up using sterile technique. It has a triangle on it which will match with the C-clamp. And I can apply it with sterile technique by pressing underneath it. And it gives a good snap, and that means that I am in place. This triangle is where you're going to see the exit site. And this pin is where the main part of the pressure will be over the artery. So I can see that I'm not in the correct place, and I can move the clamp with this black dial so that I am in about the right area. And then I can tighten it using this one as well. So I want to open up my boat next. And then I will get my sterile gloves ready to go. So we open up the sterile gloves. I usually put it on the patient's chest. I also want to make sure the patient's blood pressure is set to go off every 5 minutes during the line pull. And I want to monitor the oxygen saturation during the entire line pull as well. So during a real line pull, I would have an RN assist me at the beginning of the line pull in case I have problems with bleeding. Also, at the end of the line pull, when completing it or removing the C-clamp, I would have another person assist as well. If you have any symptoms of a vasovagal episode where the blood pressure drops and the pulse drops, an RN needs to be able to give atropine. So an RN should be available for the entire line pull. So before I apply my sterile gloves, I want to remove the dirty gloves, go wash my hands or use the alcohol rinse, and then apply a clean pair of unsterile gloves. Some people don't want to double glove. I just prefer it because gloves do break, do leak, and also there's a lot of powder underneath the sterile gloves. So now that I have a clean pair of unsterile gloves, I'm going to apply my sterile gloves using good sterile technique. Now that I have my sterile gloves, I can check the pulse here. Okay, so next, I know that this is the correct spot that I would put the pressure down. So I'm going to unscrew this black knob and guide it down so that the main pressure is here underneath the pin, and the sheath where the exit site is visible right here on this triangle. So it's in the right spot. I'm going to hold pressure with my left hand right here on the clamp, and I'm going to pull the sheath with my right hand here. So you can see why I had to pull back the blood, because I could strip a clot as I pull this sheath out. So I'm going to apply some light pressure until the very end, and I feel it let go, so then I'm going to apply a lot of pressure. So now the sheath is out. I'm going to screw the black knob to tighten it up. I can let go gently, and there's no bleeding, but if I do have bleeding, I can increase the pressure here. So I can increase it gently here until the bleeding is stopped. And then if I do have some bleeding, I can gently dab it here to get rid of that extra blood, because blood could make it slip. So you can increase and decrease the pressure here. I would remove my gloves at this point, my sterile gloves, and I'm going to go down and check the pulse in the foot to make sure that I did not get occlusive pressure. I do not want to get occlusive pressure because many of our patients have peripheral vascular disease, and it puts them at risk if we're getting occlusive pressure. So if I have occlusive pressure, I wouldn't want that for more than 2 minutes. And the way to decrease it is just to screw this black knob, and you can remember by righty-tighty, lefty-loosey. And also there's an increase and a decrease arrow on here. So if I need to decrease, I can turn it this way. After 15 minutes, I can start decreasing the pressure by a couple of turns every 3 to 5 minutes, so that by the end of 30 minutes, I will have a very, very light pressure. So to remove the clamp, I want to apply some pressure at the pulse, and I'm going to just keep decreasing the pressure. So now it's really off the skin. So I can turn this black knob and swing it up out of my way, and still holding pressure here over the pulse, and remove the clamp from underneath the patient. I'm holding light pressure on the artery. I'm going to grab another gauze, and at this point I could remove the pressure from the artery. And that's the way I would check to make sure that there is no bleeding. So you just press gently on the site, and lo and behold, we have no bleeding. However, if you do have bleeding, you can just apply handheld pressure on the artery. So to complete the line pull, I want to use a little bit of betadine ointment on the exit site. And you want to do that so that you don't touch the outside of the package on the patient. So you want to squeeze out a little bit and apply it to the exit site. And if I get too much, I can wipe it with some gauze. So I'm just going to dab at it to get rid of that extra betadine. The next thing I want to do is apply a Band-Aid. So here's the Band-Aid. After I've applied the Band-Aid, some nurses prefer covering the site with a clear plastic dressing. In order to do that, I grab 2 to 3 4x4s and fold them up into a square. And this will just give a little bit of occlusive pressure. I'm going to peel the plastic dressing, and I stretch it over the site, and so that it gives a little bit of extra pressure. It is more difficult to do this without the extra pair of hands. Then I just peel the edges off the clear plastic dressing, and now I want to tell the patient to hold some pressure over the site with their hand if they're going to laugh, cough, sneeze, or pass gas. Any of those things could pop that newly formed clot. So I need to teach the patient about that. I also want to come back and check the site very frequently to make sure that there's no bleeding or hematoma. So that's it for the arterial line pull using a C-clamp. If you have any questions, please ask your educator.